In 2004, Missouri legislature passed a bill that required all Missouri hospitals to report their healthcare-associated infections as an additional way to minimize infections that patients acquire during the course of receiving treatment for other conditions. Recently, Phelps County Regional Medical Center was recognized in Consumer Reports magazine for having reported 0 central line-associated bloodstream infections for 2009.
A central line is a large catheter that's placed in the neck or upper chest area. We use it for multiple medications or maintenance IVs, plus if they need some extra nutrition, and if they have poor vein access to, we will place a central line catheter.
The report that you see on Consumer Report is from 2008's data. It states that we have 0 infections, which we do, but we actually have 2 years of no infections in the ICU central line data. We have 2008 and 2009 that we're proud to say that we have no infections. Central line infections was chosen to be monitored by the state of Missouri because it's a high risk and high volume procedure to be performed in the ICU unit. You have more patients who are sicker or their immunity is lower, and when you introduce a central line into a patient, you actually can introduce a bloodstream infection if it's not monitored, which can increase a 7-day hospital stay and cost as much as $30,000 to $60,000. I think the average they stated in Consumer Reports $42,000. But if you look at everything, the procedure is high risk. You have patients who are severely immune, have problems, and then you have the high procedure rate that we do ICU central line insertions. So that's why it was monitored. Our 0 central line infection rate is attributed to the teamwork here at the hospital, from the surgeon or the physician who is inserting the central line to the nurses that are maintaining it. One of the procedures that we monitor at the beginning of the insertion is that we have a 5-step that we have to make sure that all the physicians and the surgeons perform. Hand hygiene is the first step, then full barrier protection is the second step, which includes a gown, a gloves, mask, hat, and covering the patient. The third one is making sure that the skin is disinfected with the proper antiseptic. The fourth one is choosing the right site to put the central line in. And the fifth one is making sure that it's monitored on a daily basis after the insertion, and the nurses is what performs that. So with the teamwork that we do here at the hospital, it's very important that everyone follows the steps, and we do, and that's what we attribute to the central line 0 infection rate.
During the placement of the central line, we have a checklist, and we work with the physician to make sure we hit all those key points on the checklist to ensure patient safety. We monitor the central lines daily. We check for the site for redness or drainage. We also make sure that the dressing's intact. We check the ports, make sure they have good blood return and flush well.